As healthcare practitioners, we all agree that the physiologic effects of a spinal misalignment complex are far-reaching beyond the spinal segment itself. What exactly occurs when postural distortions are present at the level of a dysfunctional spinal segment? Find out here. The spine supports the head and the torso, providing support for multidimensional movements. The vertebral bodies give the spinal column the power to absorb and distribute compressive forces. The facet joints enable hydraulic lift, and of course the intervertebral discs have shock-absorbing qualities. With proper spinal alignment, the body moves with muscular efficiency and proprioceptive control. Disturbed kinematics of the spinal joint complex, however, causes unequal movements of the spinal joints, muscular compensation patterns, and compromised neurologic function. The complexity of physiologic compromise expands much further than the spinal joint complex. Consider each of the physiologic disruptions listed below that occur when a spinal joint complex is misaligned. First, unequal load sharing is identified, with higher load on one of the facets than the other, leading to elastic deformation of the muscles and the tendons. Muscles are very quick to weaken. It takes just 6 hours for atrophy to begin. Once atrophy begins, patients lose 1.5% of muscle mass per day of non-use. Muscular dysfunction leads to breakdown of tendons based upon the load of the muscle-tendon junction, causing tendinitis. Muscles and tendons suffer elastic deformation and ligaments suffer plastic deformation, which is likely to become permanent if left uncorrected. Ligaments change according to the load applied. Loss of muscle tone decreases joint tension and increases the load to the ligaments. Cartilage is where the most severe damage can occur. It heals the slowest and the least. Nutrition is absolutely critical for repair of cartilage. Functional movements are fundamental to restoring nutrition to injured tissues. With compromise to the cartilage, vertebral discs degenerate, causing decreased rotational torque. The spine often suffers from 25% less rotational ability at the affected joint complex, limiting dynamic posture, making the patient more susceptible to injury. Nerve pathways become defacilitated with restriction, and the associated part becomes weak and clumsy. Just the weight of a dime is the amount of pressure needed to a nerve to cause damage. The longer the nerve is not functioning, the more likely the effects will become permanent. This is an approximate 2-year period of time to regain function to the nerve before it becomes permanently affected. Spinal mechanoreceptors provide continuous feedback of where our bodies are in space to keep us upright against gravity. Feedback from these receptors is used to initiate postural compensation, resulting in the activation of muscle groups to maintain or restore equilibrium through body sway. Spinal mechanoreceptors are sensitive to the position of the body. Therefore, malposition of a spinal segment initiates postural dysfunction. Vasculature, too, becomes compromised, causing hypoxia in certain tissues and decreased circulation. Your patients notice this effect as diffuse pain or tingling in their extremities that do not follow a specific nerve pattern. Adhesions and bony degeneration such as osteophyte formation occurs. Wolff's Law states that any abnormal stress to the bone creates bony abnormalities. With bony abnormalities, we see more and more restriction to human movement. Osteoarthritis, or DJD, is caused by improper biomechanics and mechanical stress of joints due to uneven weight-bearing forces or repetitive misuse activities. Dysfunction at the level of the spinal column affects the structure and the function of the entire human organism. To optimize human performance, find out more about how you can become a certified posture expert and correct whole postural distortion patterns with the American Posture Institute's proven postural correction system.